1035 WICY Feel Good Favorites from the 80s and more. Wednesdays, right around 9:40. We're always joined by those of Alice Hyde Medical Center for our Alice Hyde update. It's Inside the Community. And Jen Shull's with us, Pediatric Nurse Practitioner. Jen, a frequent guest we've had here lately, and thank you so much for all you do.
I'm glad to help.
Well, you're going to help us today specifically with something that we all have to watch out for, but especially kids, because they're the ones who like to go and explore a little bit. Poison ivy in kids. What do you got for us on that?
You know, I'm so glad we're having a gorgeous summer. We're getting some wonderful weather. We're getting out there. We're playing, but kids are into everything, which means we can easily get into poison ivy. Everybody's heard it before. Everybody's dealt with it, probably worried about it. Oh my gosh, what can I do? What does it look like? What am I dealing with?
Right. That's what we got to consider. And so when someone does, get poison ivy, or, particularly a kid, in most cases, what are the symptoms of the rash?
So most people know it's the oil of the poison ivy that actually starts this rash. And when we scratch it, that oil gets under our skin, under our nails especially. So, the symptoms are pretty annoying. It's really itchy. There's redness, there's swelling, there's bumps. A lot of times they look like a line because that's how the plant has actually touched our skin. So, when in doubt, bring your kiddo into the office. We'll check them out.
Yeah, now we're going to move on to specific, treatment for it.
Yes. So first and foremost, wash your kid with cooling water, nothing hot, because that will actually make it worse. However, if your kid has inhaled smoke or burning from when they're doing brush, if there's poison ivy in that, they should absolutely get checked. If the rash is on their face, what can we do at home? Those oatmeal baths, cool compresses, calamine lotion, hydrocortisone creams. If itching's really, really bad, you can use Benadryl, but call your provider to just check in and see what that dose should be for your kid.
Absolutely. And, at what stage or at what point do we need to call a provider if we have to, or pediatrician?
Absolutely. If it's not getting better with you doing all those home remedies, if the rash is on the face, if it's all over the body, really covering a large portion, if it looks like they're infected, if it's really, really red, warm to touch, or really swollen.
Gotcha. All those things check as far as consideration goes. Yeah, this is a factor. I remember having poison ivy when I was a kid a couple times, and it didn't go to the face or anything like that, but it can easily do that. That's the thing.
Yes.
So, well, Jen, thank you so much. Anything else for us today?
Nothing else. Glad to be here.
No, we'll be sure to have you back in here soon enough. Thanks again, okay?
You're welcome.
1027 1035 WICY Inside the Community with those at Alice Hyde Medical Center every Wednesday at 9:40.